Good afternoon, and welcome to Lunch Date with DESC. My name is Karen Breckenridge, and I'm a proud member of the DESC Board of Directors. On behalf of the entire board, I would like to welcome you to DESC's Spring Fundraiser event. We are pleased to have so many of you here with us today, including DESC board, staff, and volunteers, community leaders, and all of you who have provided so much support to DESC over the years. We're also very excited to have those of you here today who are learning about DESC for the very first time. Our mission at DESC is to help people with the complex needs of homelessness, substance use disorders, and serious mental illness to achieve their highest potential for health and well-being through comprehensive services, treatment, and housing. As many of you know, DESC in the past has hosted an annual breakfast event. We sincerely regret that we cannot be with you all in person this year. However, we're so pleased to see all of your faces in this virtual format. I hope by now you've all had an opportunity to familiarize yourself with the virtual platform and perhaps had a few minutes to mingle with friends and colleagues at your tables. There will be another opportunity to mingle with other guests at the conclusion of this presentation. In the meantime, however, I invite you to sit back, relax, enjoy your lunch, as we share with you a few video segments about the incredible work DESC has been doing in our communities. And so, without further ado, I would like to introduce Daniel Malone, Executive Director at DESC. Let's join Daniel from the DESC main shelter, an area that has been the subject of much attention in the past year.
Hi, thank you for joining us for lunch today. I hope you've got something delicious to eat and you've enjoyed mingling with one another at the tables that we've set up for you. So I'm excited to join you today from our original DESC location, what we in recent years have called the main shelter on the second floor of the Morrison in Pioneer Square. For more than 40 years in this very space, we welcomed people inside every single night without a break. 14,750 plus nights where we never missed one until almost exactly a year ago on April 9th of 2020. We moved all of the staff, all of the clients to a wonderful hotel setting in order to have a more appropriate place for people to be during the pandemic. Not only has the hotel arrangement allowed us to provide for the physical separation that's so necessary during the coronavirus pandemic, but it's forced us to see that this old way of providing emergency shelter just isn't up to the task anymore. The disaster-style shelter we have with people sleeping in these bunk beds just isn't appropriate to the needs of people who need to be here for more than a few days or a couple of weeks. So we are seeking to permanently replace this location with something like what we're able to use temporarily now with the hotel, a place that is calm, has private spaces for people, and we expect to accomplish that. Meanwhile, we're using other parts of this shelter environment as a makeshift coronavirus vaccination site. You're hearing today about the major changes we've had to do in our work due to the pandemic. And thanks to the very hard work of our internal COVID team, of our testing and vaccination partners, and so many other people in the community, we've been pretty successful at this work. The virus has certainly made its way into the population of people we serve and even into our staff, just as it's penetrated the broader public. But it's really thanks to these efforts that so many people here have been closely involved in that we've maintained a infection rate that is significantly lower than the overall infection rate in King County. And I think it's truly an amazing feat, and we can't thank enough the people who work here and our clients for being so cooperative in making sure that this didn't turn into a much worse disaster than it could have been. We have a lot to look forward to in the coming year. We will figure out permanent replacements for our congregate emergency shelter spaces. We are creating more than 400 new units of supportive housing. Much of that is actually already under construction, and some of it will open later this year. We are expanding some of our street outreach work focused on people on the streets with serious untreated mental illness. We are expanding some of our behavioral health crisis response work, which serves as an alternative to law enforcement. We have under construction right now the clinic at Hobson Place, which will be the area's first fully integrated physical and behavioral health care clinic focused on the needs of the highly vulnerable and disabled population that we serve here at DESC. And we're advancing our equity and social justice work to new levels with multiple initiatives aimed at creating race equity for our workforce, for our clients, and in community partnerships. This work will be led by our new equity director position, which we have invested in to make sure that we get this work done right. Much of what I just talked about goes well beyond the creation of new housing units for our clients. And that's because while we are known for our housing first work, housing first does not mean housing only. Housing is necessary for the clients we serve who have experienced homelessness and trauma for decades. But precisely because of these long, difficult experiences they've had, their needs go well beyond just having an apartment. We need to provide them with the full array of healthcare and other services that are really crucial to their success and being able to fully integrate themselves into the life of the community. There is no doubt that it's a difficult time at DESC, but it's an exciting one as well. We are working very hard to continue serving our clients well, while we're also creating and taking advantage of opportunities that are available to us to expand our work and make sure that we fulfill the promise of this great organization. Thank you very much for being with us today.
Thank you, Daniel. As Daniel noted, the COVID-19 pandemic prompted immediate changes to the status quo. As an organization focused on the most vulnerable and most marginalized members of our community, DESC's work has been more important than ever. At a time when many of us have been asked to curtail our activities, to work from home, to attend school from home, to limit travel and gatherings, to do less, DESC has been asked to do so much more. The organization has responded to this crisis with agility and decisiveness, providing effective, efficient, and compassionate solutions to some of the most challenging problems we've ever faced. The following video segment will take us back through the past year, providing highlights of DESC programs and how they've been able to respond to this pandemic.
Now to growing concerns about the deadly coronavirus officially hitting the U.S. Here's what we know. A Washington state resident fell ill.
Now, a short time ago, the World Health Organization declared the outbreak an international public health emergency.
This is the nursing home just outside Seattle that has been at the center of this outbreak.
When the COVID pandemic went into full force here in Seattle, King County, much of my communication was with King County Public Health and King County Department of Community and Human Services. We were fortunate that our region took it very seriously and wanted to intervene as quickly as possible. We were able here at DESC to actually move pretty quickly. A lot of the initial phone calls were about how are we going to spread people apart? How do we make sure that if people do get sick, where can they go? We were also discussing what we knew at that time about the disease, which wasn't a lot, and what precautions that we could take as an agency to protect our staff and the clients that we serve.
My part in the DESC's COVID response, well, it started early on when we had no idea what was happening in this pandemic and how many people were going to get sick. As a nurse on the front lines, I was going out and assessing people, seeing if they had symptoms, seeing if they needed to be referred for testing. We were all hands on deck trying to figure out quickly how to deal with this.
Early on in the COVID pandemic, we realized shelter programming, particularly crowded congregate shelter programming, was inherently dangerous for the risk of spread of COVID. So we worked with our city partners to quickly decongest our most crowded spaces as fast as we could. The key strategy to avoid catching COVID in the first place is to stay at home and avoid crowds. That's pretty difficult when you're experiencing homelessness because you don't have a home, and likely your best bet for seeking shelter is historically been in crowded facilities.
The setup in our main shelter was bunk beds. There's not a lot of space between people. Congregate shelters are really organized and constructed for the biggest bang for your buck, so getting the most amount of people off the street into that space. And that's considerably different than the way we view shelters with COVID.
Through a pretty heroic effort of a lot of our shelter staff, we moved out about half of the people in our most crowded facility into a new shelter that we stood up over a weekend in early March up at the exhibition hall in Seattle Center, where we remain to this day.
DESC came together to create a COVID response team comprised of people that are from our clinical programs, our housing programs, and our medical programs. This COVID response team basically pulls expertise from all of these different groups of people to figure out how do we monitor the people under our care. By that I mean assessing people for symptoms.
That team has been invaluable in being able to both be quick and efficient in getting people who have tested positive or have been a close contact of somebody experiencing COVID-19 to isolation and quarantine facilities, which is one of the most effective ways of ensuring one case doesn't turn into an outbreak.
PPE became extremely important to us because we knew that we needed to protect ourselves and we needed to protect our vulnerable clients. So we did the best we could. We read all the research we could. We looked at everything that we needed to do, and I think that hugely contributed to keeping our case numbers low. Since testing was so difficult at the beginning, we really didn't have access to a lot of testing. We learned how to do the testing ourselves. We were able to secure a lab with King County Public Health, and now we can test whenever, whoever we need to test.
Our first case here at DESC occurred on April 2nd. In retrospect, our reaction was probably an overreaction, although I have no regrets about that because we want to make sure our staff and clients stay safe. This highlighted the importance of the connections that we have with our public health partners, the importance of communication with our teams. We learned a lot after that first case, and this internal COVID team was able to develop some policies and procedures that made more sense. Vaccines first came available at the end of 2020, and there was a tiering system. Any staff who wanted to get a COVID-19 vaccine was able to by the end of 2020. Our goal is to be able to coordinate and vaccinate our clients as soon as we can. Because of the tiering system, it's going to take some time. There's also supply chain issues. Our hope is that we can coordinate across all the different medical staff to vaccinate people who are willing to get vaccinated quickly.
After our move to Exhibition Hall, we were there for several weeks. It became apparent to us that that wasn't going to be enough, that congregate settings are inherently still dangerous, even if they're more decongested and there's more space. So we worked closely with our partners at King County to shut down our largest congregate facility and move into a hotel in Renton, the Red Lion. That was a pretty heroic lift for a lot of people that also happened remarkably fast. We went from planning to moving in and operating in about 5 days.
The client's initial reaction upon arrival at the Red Lion was absolute disbelief. The idea of going behind a closed door and just being alone with your thoughts was not something that the main shelter was able to offer. That whole experience has a volume to it. It has a decimal level to it. And the best way I know to describe is moving to the Red Lion, we essentially turned the volume all the way down.
They had a bathroom to themselves, a door they could shut. 3 meals were provided every day. For me, coming from a place of homelessness in years past, just being able to shut a door and have some privacy is so good for people's mental health, and I just saw people improve leaps and bounds.
It was almost immediate that we noticed that this was going to be an enormous improvement for people and that people were going to have an opportunity to improve their quality of life and recover that they were just not afforded in a congregate setting. I was not surprised by that. I was surprised by the speed in which that happened. Many clients who we've known for years, who have experienced homelessness, some cases for decades, who have struggled with the basics day to day, seem to almost become unrecognizable overnight when they're afforded the opportunity to set their own schedule, get a good night's sleep, shower on their own terms, plan their day in a way that you and I all take for granted.
Looking back at how DSC has responded to COVID, I am deeply proud of what individual staff members and teams and the agency has been able to do. The rates of COVID positive tests within DESC has been consistently lower compared to the county, the state, and the country. There's no way that any of this could have been successful if we did not have the staff working here that we do. Their commitment to taking care of their colleagues and taking care of the clients that we serve has been a significant driver in keeping people safe and healthy.
I'm incredibly proud of how DESC has responded to this. It's like anything else that we do at DESC, it's really from the ground up, and we learn how to do it and we become pioneers. We figured it out.
Hello and welcome back. In addition to leading the way in responding to the pandemic and continuing to keep our clients and staff safe, DESC has continued to carry out its mission of providing comprehensive services, treatment, and housing. DESC currently serves over 8,600 clients per year and over 2,900 clients per day. DESC provides permanent supportive housing for over 1,400 tenants and emergency shelter and hotel programs for nearly 500 guests. The following video segment highlights a small but important program at DESC, our Peer Counselor Program, as well as DESC's work at the Drop-In Center at 216 James Street.
The Drop-In Center is a place for people who are unhoused or unsheltered to come in, do their laundry, get some food to eat, hot coffee, take showers. We have groups there as well for anybody within our programs. It's a place for them to just come and be able to talk about what's going on in their lives.
Lou Middleton is the founder of the 216 Drop-In Center. You could tell the passion that Lou had for our clients, and I try my best to exude that passion and that same respect and that same empathy every day and bring it to work every day just because Lou did it so well.
The 216 peers that work out of the Lou Middleton Drop-In Center really focus on crisis support and helping people who are actively homeless. They have their own lived recovery story and are participating in their own care.
One of the requirements to be a peer is you have to have lived experience, whether it's with substance use disorder or mental health. There's clients that you have connection with and you've been through some of the pain they've been through. They just understand what you're saying and you can just help them however little bit you can.
It's nice to know that there's people who've been through this who are on the other side. And I think it's just come away with gratitude for people who do this kind of work, because I don't even know where I would be without it, right? So
I've been a peer counselor now for about 5 years. I was homeless, me and my son. We stayed in the car for 6 years. Yeah, so it was a lot, but I got through it. I found out that there was a lot of people out there who did not have an advocacy. They didn't have a voice. And it just made me that much more want to be a peer to give them a voice.
COVID has made it really tricky. We took as a group a big shift in what we did day to day. Pre-COVID, we served about 75 clients a day, and our doors were open. We had things flowing. It was a busy place to be. These days, we have to be really safe and intentional about who we invite into those spaces and making sure that they can comply with policy around wearing protective glasses and wearing masks and washing your hands.
Things like hygiene services are essential. People need to be able to take showers. People need to be able to do their laundry. People need to eat, and COVID or not, we need to do that. So we stayed open through the whole thing.
We have now gone to serving outside in the bus tunnel right outside of the clinical office.
We are currently working on further developing our groups and building more into our clinical teams and bringing them in with the intention that the drop-in can get back to what it felt like pre-COVID, a haven where people could come at any point in their recovery and be able to access our peer specialist support.
I love working for DSC. I just stay super grateful for the ability to work in a job where I get to help other people on a daily basis.
I was sending a client to detox. He was going to detox the next day. And I tell this client, I have complete faith in you and I believe in you and I know you can do this. And he looks at me and he goes, you're the first person who's ever told me that. And then a client that was sitting next to us said, Sasha, you make more of a difference than you know. That is by far one of the biggest compliments I've ever received. It's an extreme honor to be able to have that kind of impact on a client.
Thank you. Welcome back. The outstanding programs highlighted in these video segments would not be possible without the hard work and dedication of DESC staff. At DESC, we believe in the inherent value of every person. DESC staff meet their clients where they are, without judgment, and help them to achieve their highest potential of independence, self-determination, and personal responsibility. In the following video segment, we are excited to highlight the DESC staff, their perspectives on what DESC does for our clients, and how you can support these efforts.
DESC is a place where we do a little bit of everything for the people who need the most.
The philosophy of DESC is meeting our clients where they're at.
Meeting people where they're at.
We have to meet the client where they are.
We're like the Good Samaritans. We get the person off the side of the road, give them a place to stay, and take care of them from there.
I advocate for the clients. You know, wherever they need me, that's where I go, because our clients don't have the support from their family, and they call us family.
When you're staying in a shelter, it's the last place to go.
We have shelters, we have housing projects, but we're all about centering every human being's innate right to housing.
That's what Housing First means. Get the person off the side of the road, give them a place to stay, and then take care of their other issues.
We are willing to do the work that other people don't want to do or will not do.
We serve the people who are most neglected in this world.
A DESC is a voice that listens to them and takes them as they are.
And not, judging them for what they're doing.
DESC is an embodiment of empathy, and the world needs more of that.
Someone that I worked with recently, she was kicked out of her family home that she grew up on, and she didn't have a formal education.
We have one client, had been abused all of her life.
This client, he had cancer. Even though it was off the clock, I still showed up at his bedside.
She has her own place, reunited with her children that, she's given up for adoption over the years. She's just a happier person, and we made a snowman the other day.
She's come full circle from not having anything and being out on the streets and being vulnerable, and now she's off. She doesn't use us anymore. And I guess that's the full circle, that's the goal.
DESC is like a place to stop and just sit and think and come face to face with who you are as a person.
And so that's what's important to the community, because if it wasn't, if we weren't here, what's going on around you would be a lot worse.
Help us help them.
Help us help them.
Help us help them.
Help us help them. Thank you.
The compassion and dedication reflected in that last segment represents so much about who DESC is. Thank you for being here. We are extremely proud of the work that DESC is doing, and there is so much to look forward to. Thank you for your support. This concludes the video presentation, but we invite you to stick around and mingle, virtually of course, with your friends and colleagues at the tables. Thank you and take care.